Hello everyone, I'm Dr. Leslie Kernisan, board-certified geriatrician and the founder of BetterHealthWhileAging.net. In this video, I'm going to talk about one of the top things that I address in my practice to help my older patients live better, especially if there have been any concerns about memory loss or brain health. And that is what to know about a very common type of medication that geriatricians consider risky for older adults. They are called anticholinergics. In geriatrics, we always want to try to identify and then potentially cut back on these medications because they slow brain function, they can cause or worsen memory loss, and they've even been linked to developing Alzheimer's or other forms of dementia. And this is not a fringe issue. The impact of anticholinergics on brain function and aging brains have been known about for decades. Still, these types of medications continue to be widely prescribed in medicine, even to older people. Also, many commonly used over-the-counter medications are anticholinergic, such as Benadryl. In fact, when I review medications for older adults, I find that many of them are regularly using an anticholinergic medication, sometimes even more than one. Now you might be wondering, how is it possible that so many older adults are regularly taking medications that we know affect brain function and might be bad for their brain health? Well, this is happening really for two reasons. On one hand, most older adults have never heard of anticholinergics and have no idea how common it is for them to be taking or prescribed a medication that can affect brain function and that might cause or worsen memory loss. And then on the other hand, most practicing doctors have not been trained to avoid prescribing medications that become riskier as people get older. So even though in geriatrics, we're trained to identify and reduce these medications, most doctors have not had geriatrics training, and so it's not top of mind for them. And this is a known healthcare quality issue. What's especially troubling is that in most cases, there are more effective or safer ways to manage whatever symptom or condition the anticholinergic medication has been prescribed for. So basically, we currently have a situation in which tens of millions of older adults are unwittingly using medications that aren't good for their brain, even though those medications aren't strictly necessary for their healthcare. This has bothered me for a while, and so I've concluded that to change the situation, we need not only to change what doctors are doing and how they're trained, but we also need to help more older adults and families learn about this type of medication so that they can play a role in spotting them, in avoiding them, or in partnering with their health providers to use them with caution. So that is my goal for this video. Specifically, I'm going to explain to you what makes a medication anticholinergic so that you understand what it means and what it means for the body and brain and why these tend to affect people more as they get older. And then I'm going to take you through 7 commonly used types of anticholinergic, what they are, what they're usually prescribed for, so that you'll know what to look out for. Let's get started. Now, what does it mean for a medication to be anticholinergic? Well, an anticholinergic is a medication that has the chemical property of blocking or otherwise diminishing the effects of a very important neurotransmitter called acetylcholine. A neurotransmitter is a compound that helps neurons, so that means nerve cells, communicate, whether they are in your brain or elsewhere in the body. And it turns out that acetylcholine is used quite a lot by brain cells. Your brain cells need to use acetylcholine to communicate with each other in order to help you think, remember, and use your brain for other cognitive functions. Acetylcholine is also widely used outside the brain. In fact, it's used throughout the body, often in ways related to what we call the parasympathetic nervous system. So basically, the body has something called the autonomic nervous system, which is not under your voluntary control, but regulates a lot of your bodily functions. And one part of it is the sympathetic nervous system, which generates what people often call the fight or flight response. That system mostly does not use acetylcholine. However, the counter to that system, the parasympathetic nervous system, which generates a lot of your rest and digest functions in the body, that one does heavily rely on acetylcholine. So anticholinergic drugs often have side effects related to the eyes, the bowels, the bladder, or the mouth. Things like dry eyes, dry mouth, constipation. These side effects can definitely be problematic in older adults, but honestly, it's the brain side effects that usually I find the most concerning. Because when acetylcholine is blocked in the brain, this leads to decreased brain function, which people often experience as sedation. Now, this may be why people are taking the drug. Lots of people take Benadryl to help them sleep, and this might be something that you've tried yourself. And a little sedation might sound benign to you. But when the brain is older or has otherwise become vulnerable, that acetylcholine blocking can become more problematic. It can cause or worsen memory loss. In people who have already symptoms of Alzheimer's or another dementia, it can make them worse. And it also, because it's making people drowsier and slower, can increase fall risk. In fact, it turns out that anticholinergics literally have the opposite effect of drugs that were developed to treat Alzheimer's and other dementias. So you may have heard of a medication that is called Aricept. The generic name is donepezil. This was the first blockbuster medication for the treatment of Alzheimer's. And what it does is it increases acetylcholine in the brain by blocking the brain enzyme that breaks it down. And this drug was developed because it was noticed that people who were experiencing Alzheimer's and some other forms of dementia seem to have not enough acetylcholine in the brain. And so this drug was developed to help boost it. So you can imagine that if we are giving drugs to help boost acetylcholine in the brain of people with Alzheimer's, maybe it's not great for the brain when we give people medications that have the usually unintended effect of blocking some acetylcholine function in the brain. And in fact, research has shown that chronic use of anticholinergics is linked to having a higher risk of developing Alzheimer's later in life. So I hope you now see why geriatricians love to hate anticholinergics. Let me now take you through 7 types of very commonly used anticholinergic medications so that you'll know what to look for. And in this video, I'm going to focus on medications that are especially used in the outpatient setting. All of these medications are on what we call the Beers list. That is a list maintained by geriatricians for the past several years of medications that are potentially inappropriate for older adults because they're risky. So they're medications that older adults should avoid or use with caution. And all the medications that I'm going to tell you about in this video are on that list. So first type of anticholinergic medication I want you to know about are sedating antihistamines. And these are often available over the counter in drugstores, pharmacies, and grocery stores. The most common one is probably diphenhydramine. The brand name is Benadryl. Now, you may also be wondering, what about other antihistamines that are now available over the counter, such as loratadine, brand name Claritin? So it turns out that the non-sedating antihistamines are much less anticholinergic. So these are safer for aging brains. And so if you're having allergy symptoms, I would definitely recommend using a non-sedating antihistamine rather than a sedating one. Next on my list of common anticholinergics you should know about are the PM versions of over-the-counter painkillers. So things like Tylenol PM, NyQuil, or Advil PM. And this is because the PM in those medications comes from mixing in a mild sedative, usually a sedating antihistamine, with the analgesic. So next time you're in the drugstore, if you pick up one of these items and take a look at the ingredients, you'll see that probably it includes either diphenhydramine, so again, that's brand name Benadryl, or another sedating antihistamine called doxylamine. Both of these are strongly anticholinergic, and so I would recommend being careful about using these. There are also available over-the-counter sleep aids such as Unisom. Well, if you look at the ingredient, it's generally just diphenhydramine or another form of sedating antihistamine, and it is anticholinergic. So if you want to manage pain at night, I would just take the straight-up painkiller. And if sleep is an issue, then I would recommend talking to your doctor about another way to manage your sleep that doesn't involve these types of medications, and you should also be careful about other sedatives. We'll cover that in another video. Number 3 on my list of types of anticholinergics you should know about are medications for overactive bladder. So that's because it's the parasympathetic nervous system that manages a lot of bladder function. And so when you block acetylcholine, the bladder relaxes and doesn't squeeze as hard or as often. These kinds of urinary issues are very common for older people, so many older adults have been prescribed a bladder relaxant, such as oxybutynin, brand name Ditropan, tolterodine, brand name Detrol, or solifenacin, brand name Vesicare. Unfortunately, all of these medications are quite anticholinergic. So That doesn't mean that it's absolutely out of the question to use them, but it is something to keep in mind because often there are other ways to manage overactive bladder symptoms or other urinary symptoms. And it's important to ask your health provider about those before you use this type of medication chronically or in a person who is having memory loss symptoms. Number 4 on my list of anticholinergic medications are medications for vertigo, motion sickness, or nausea. So one common example is meclizine. The brand name is Antivert, which is often used to treat benign positional vertigo. So this is a condition that does affect older adults where people have a feeling of spinning around them or the floor tilting, and it's related to a condition affecting their inner ears. This has historically been treated with meclizine, but it turns out that there are special forms of physical therapy that can also treat vertigo. You also want to make sure, if an older person is taking this medication, that they truly did have vertigo. I once had a patient who was very attached to this medication because he often felt wobbly or dizzy. But when I asked him about it, he actually felt lightheaded when he stood up because his blood pressure was coming down when he stood up. That's also very common in older adults. And that was not a problem that could be fixed with the meclizine. For that, we had to adjust his blood pressure medications. So we ended up adjusting his blood pressure medications and also realizing he didn't need that meclizine, and that was safer for him. He was about 90. Another medication that you've probably heard of that is used for motion sickness or nausea would be dimenhydrinate, brand name Dramamine. So this too is quite anticholinergic. So if you only use it every once in a great while, that's okay. But again, something to keep in mind if you're reaching for it often. The 5th type of anticholinergic medication you should look out for are medications prescribed for itching. So again, these are usually some form of strong oral antihistamine, such as again, diphenhydramine, Benadryl, or there's another one, hydroxyzine. The brand name is Vistaril. If you have been experiencing itching, then it would be useful to talk to your health provider about whether there might be a topical cream that could be used that often has fewer side effects for older people, or is there another way to manage this problem? Actually, a lot of older people end up quite itchy because they have dry skin, and just really doubling down on moisturizers and skincare can improve their itching. Number 6 on my list of commonly used anticholinergics are medications for nerve pain. Specifically, there's an older class of antidepressants that we call tricyclic antidepressants, which now have kind of fallen out of favor for treating depression because we have a whole crop of newer antidepressant drugs, specifically the SSRIs, selective serotonin reuptake inhibitors that we use for depression. But that older class of tricyclics used to also be used to treat nerve pain. And so sometimes they're still prescribed for nerve pain, even though, again, we now have some newer, better medications for nerve pain. So some examples of this type of medication are amitriptyline, the brand name is Elavil, and nortriptyline, the brand name is Pamelor. These medications are also sometimes prescribed to treat shingles because a while back we thought that using these medications might reduce the risk of developing the post-shingles nerve pain. It's called post-herpetic neuralgia. But actually now the research indicates that maybe these tricyclic antidepressants are not particularly effective for preventing that. So probably what's best if you don't want to get pain from shingles is to get the shingles vaccine. And otherwise, if you find that you are taking one of these tricyclic antidepressants, I would recommend bringing it up with your health provider to see if there might be an alternative way to manage whatever the tricyclic was prescribed for. And then number 7 on my list of commonly used anticholinergics are muscle relaxants. So these are often prescribed for back or neck pain, and probably the most common example would be cyclobenzaprine. The brand name is Flexeril. So it's important to know that cyclobenzaprine is quite anticholinergic. So especially for older adults, we want to be careful about using it often or regularly. Also, back pain and neck pain are other conditions that often can be managed through other methods, and it's not clear from the research that using cyclobenzaprine particularly improves outcomes beyond the other ways that we manage back pain. So those are the 7 really common types of medication that are anticholinergic. Now I'm going to add one more. It's off on its own because this particular medication is anticholinergic, but the other medications in the same group are not. And that medication is paroxetine. The brand name is Paxil. So this is a medication that is in the class of, again, SSRI antidepressants, so selective serotonin reuptake inhibitors, and they are used both for depression and for anxiety. So most of the medications in this class are not anticholinergic, but Paxil is. And that's why in geriatrics, we almost never prescribe this for depression or anxiety. And as people get older, if they come into our practice, we often try to transition them to one of the other SSRIs that we consider safer for older people, such as escitalopram, citalopram, or sertraline. The brand names are Lexapro, Celexa, and Zoloft. So that covers my list of commonly used anticholinergic medications. I have focused mostly on medications that are used in the outpatient setting. There are many more medications that we use less often or that we use especially in the hospital that are anticholinergic as well, such as certain nausea medications and certain medications for other more specialized conditions. If you want to see a longer list of anticholinergic medications, in the description for this video, I'll have a link to my related Better Health While Aging article. And in that article, we have a link to a longer list that is available online. Now, who should avoid anticholinergics? So, as you can see, these medications are pretty common. They're everywhere. Do we all need to be avoiding them? Well, I think there are three groups in particular who should make a special effort to identify and avoid anticholinergics if possible. So first, people who are concerned about their memory or thinking right now. So if you've noticed some symptoms of memory loss or thinking problems, or you've gotten worried about your brain function, I would definitely recommend making an effort to minimize use of anticholinergics. Two would be people who have actually been diagnosed with a cognitive condition, such as mild cognitive impairment or a dementia such as Alzheimer's disease. So most of those people have an underlying change to their brain. Their brain is damaged and vulnerable. Their brain cells, right, are changing. That's the nature of Alzheimer's disease, is that it's slowly changing and diminishing the function of your brain cells. So those people especially need all the help they can get for their brain cells to work at their best, and we want to be careful about anticholinergics in that group of people. And then third would be people who particularly want to minimize their risk of developing Alzheimer's or another kind of condition later in life. Now, if you're worried about the long-term risk associated with anticholinergics, you should know that as best we can tell, the risk seems to be associated with cumulative use, both how long and how high the doses. So if you've only used anticholinergic medications occasionally here or there, I wouldn't be too concerned. If you've used it regularly for a while, that's not ideal, but you know, the past is past. Just think about what could you maybe change or do right now to reduce your use of those medications. And so what should you do if you actually have been taking an anticholinergic? So again, if it's just occasional, I wouldn't worry about it. But otherwise, in general, the principle with risky medications is that we want to look at them and think about, can we stop, if at all possible, or can we switch to a safer option? Or if not, how can we reduce it to the lowest effective dose? So if the anticholinergics that you've been taking have been over the counter, generally you can just stop those on your own. But if they have been prescribed, I do not recommend that you stop or reduce on your own. Instead, I would highly recommend that you bring it up to your usual healthcare provider, your doctor, or you could potentially talk to a pharmacist, and that you ask them to explore alternatives and ways that you might reduce your use of this medication. It can help to do your research first. So specifically, I recommend thinking about what symptom or problem was this anticholinergic medication prescribed for, and then you could do a little research online to find out what are other ways to manage this condition. So for instance, there are often non-drug ways or ways that don't require anticholinergics to manage urinary symptoms or pain or allergies. So having done that research before you come into the health provider, it can help ensure that you'll consider all the options and all the safer options when you talk with your health providers. Now, in some cases, there actually are not any good, easy options for managing a certain symptom or condition without an anticholinergic. If that is your situation and it seems like you're going to have to continue regularly using an anticholinergic, please don't panic or worry about it too much. In general, it is reasonable to continue taking taking a risky medication if the likely benefits outweigh the risks and if alternatives have been explored and found wanting. Furthermore, there are other ways that you can maintain your cognitive health or help your brain think the best it can be. So yes, in a perfect world, maybe you wouldn't be taking the anticholinergics, but if you do need to, don't worry about it. Just look for other ways to maintain your best possible health. So now you know about the 7 common types of anticholinergic medication that you can look out for and try to minimize if possible. Now, there are other types of medication that I would also recommend avoiding if you're worried about memory, and I will be making more videos about those soon. In the meantime, for more videos about aging health topics, including videos about helping aging parents, please subscribe to the channel or come visit us at betterhealthwhileaging.net. Take care, thank you for watching, and hope to see you again.